Dr. Naveen Mehrotra, welcome to ITV Gold. I hope you're doing well today.
Thank you. It's a pleasure to be with you, Aditi, and it's always a pleasure to be talking to the viewers of ITV Gold.
Yes, of course. We have you today for a special topic which deals with children and COVID-19. But before I go more into it and ask you questions about how COVID has been for children, I have a breaking news that has come in today on Pfizer, which has said that their vaccine is 100% effective for children from the age of 12 to 15 years old. The shots are safe. Your comments?
I think this is a great news that we're seeing today, that we're hearing about today, because our biggest fear has been, how are the kids going to get vaccinated? Because none of the current vaccines are approved for kids under 16 years of age. So now, as we're slowly bringing that age factor down, it's getting to be more of a relief at the end of the tunnel. We still have the group of kids 12 and below that are still not ready to have a vaccine yet. So I think this is great to be able to shift that age group down from 16 to 12. So definitely, I think this is all positive news. So I'm really excited about that.
Dr. Mehrotra, I would like to ask you why you think children were not included in the prior trials of COVID-19. They excluded children and pregnant women at that point. Now pregnant women can get the vaccine shot, and we're seeing that happen. But for children, why were they not included? Was it too risky to give it to children, or were they just not a priority, according to you?
Well, I think it was multiple factors. Our biggest concern at that point was to try to get the adults as safe as possible, because the biggest amount of mortality that we were seeing, the largest number of deaths that were happening were in adults. We wanted to get something that was out there, ready to go for adults. And to get kids involved into any sort of a clinical trials is much, much more involved. You're taking minors into a clinical trial who are not able to speak up for themselves. So we really didn't want to jeopardize that. So I think at that point, that was one of the reasons. The other reasons was that the kids who were getting COVID, what we saw, about 98% of them were doing very well. And they were, coming through with just maybe minor symptoms, and a very small percentage was really getting affected adversely. So I think it was a combination of all of that. And now that we have a vaccine that is good for adults, that is effective for adults, we are trying to shift our focus and make sure that the kids also have an option to be safe.
If you were to look at some age groups, doctor, what are the age groups, according to you, in children and young adults that have to be vaccinated as soon as possible?
I think all kids do, because nobody really has an understanding of what is the role of kids in the overall COVID picture, right? So we know that kids go ahead and transmit, that they're carriers, but what rate of transmission are they responsible for? We don't have a very good handle on that. So I think every child who can be protected against COVID should be protected. So the trials need to continue to include as many kids down to as young an age as possible. When we talk about the flu vaccine that's approved for kids up to 6 months of age, because typically in the first 6 months of age, you assume that the immunity is coming through the mother's milk, through the mother's transmission. And then after 6 months of age, we want the kids to go ahead and build their own immunity. And that's where we want to get the COVID vaccine down to as low as possible, up to 6 months of age eventually.
What are you hearing around you about when this could be available for children?
We are saying that probably in about 2022 is when will be a larger option available for kids. So until then, we're really up in the air. Right. We're hoping by the fall, that's what I think a lot of people are hearing in the news, that at least the older kids will be eligible for the vaccine and that we would have it approved by then. So we're looking forward to a positive fall season coming up for all of our kids.
Right. Now let's go a little bit into COVID-19 and children, doctor. I have a couple of questions here for you. What, according to you, has been the impact of COVID-19 on children that have gotten it? A follow-up question to that is, how dangerous could COVID-19 be in children? Because I believe everyone thinks that children are just, safe from it, and I think that it's not true. So I'd like for you to give a comment on that.
Sure. The majority of the cases in kids, they might have fever, they might have some sore throat, they might have mild symptoms that tend to be self-limited, so they get better on their own. There is a small percentage of kids that have much, much more severe complications, death, MISC, which is the multisystem inflammatory condition that they get from COVID. So there is a possibility that kids can have very severe COVID disease, and we don't know what long-term effects are going to be. So is there going to be an impact that comes in a year down the line or 2 years down the line? We just don't know that. But as it stands right now, 95+% of kids do well with just fever and some mild symptoms.
Right.
The reason why kids also become an important part of the whole COVID picture, the transmission rate from kids to other, the seniors that are living at home or other adults that they're around, is the biggest fear.
Right. Could you give us some insight into this multi-system inflammatory syndrome that has been seen in children, and how dangerous could that be?
I don't think we have a very good handle on what it is and how it impacts the kids, but we do know that it can, kids who have had COVID might be at risk for MISC, where they can have multi-systems get involved. So those symptoms can land them in the hospital. They can land them and make them sick for months on end, which needs severe intensive care for those kids to get better. And I think as time goes on, we will know more and more. As research develops, we will know more and more. But until then, the probability of MISC is low. But if, they always say there's always one kid that might have had it, and that kid is the one that's going to be impacted the most.
We keep on talking about underlying conditions, doctor, when it comes to COVID-19 and how that impacts individuals. If there are children with, underlying conditions that they're born with, are they also at high risk of COVID then?
Of course. And I think when they've set up the eligibility criteria, those are some of the underlying conditions that they go ahead and make them be eligible for the COVID vaccine. So anybody who has a developmental disability, multiple genetic disorders, asthma, heart disease, anything that compromises your normal body function is something that can put you at risk for much, much more severe COVID disease. And I think we don't really know a whole lot about that because we haven't been able to study it enough. It's still fairly new. Kids who have diabetes, type 1 diabetes. So I think the list is exhaustive. And there's probably kids that are not on that list that are at much, much more higher risk that we just don't know.
Right. Are children, according to you, more likely to spread COVID-19 than adults right now?
Well, actually, we believe that the adult transmission is at much higher risk. The kids also transmit, but we don't know the exact transmission. And I guess if you've been following the CDC recommendations in terms of social distancing, now kids going back to school, and a lot of that confusion that has happened is about social distancing. What is an acceptable distance for kids versus adults? So now the CDC is recommending that kids can be okay at 3 feet social distancing, but adults should still maintain 6 foot social distancing. So what we're thinking is the reasoning behind that is that the transmission might be less, or the droplet formation, or how the virus gets transmitted from one person to the other, that distance can be much shorter for kids. So we believe that maybe the transmission is less, or maybe the transmission is not as intensive as adults. But I think it's still something that we need to investigate a lot more on.
So let me ask you something here. When this debate of sending kids back to school is one of the biggest debates right now in the country, also the fact that teachers have to be vaccinated before they go back so that the transmission is less, do you think it is safe right now, or even in fall of this year, to send all kids back to school, all of them? Because that hasn't been experimented on right now. How are you feeling about that?
So I think there are I don't think anybody has the right answer for that, first of all, because nobody knows what it's going to be like when everybody gets together. If everybody maintains their social distancing, everybody wears their masks, then hopefully the transmission won't occur. But what we do know in reality and practicality is when kids are together, they're playing, they're interacting, a lot of times their masks are off. A lot of times people get casual and forget about it, and transmission happens. So it's anybody's guess as to what will happen once everybody's back in school and how they interact with each other.
Right.
The 3-foot distance is what will be maintained in schools, but the teacher to student distance will be at 6 feet.
Right.
Now, when we bring all of those kids back into school, hopefully if they maintain all of this, they'll be safe. And hopefully there won't be such a huge surge of COVID that we're seeing as people get careless. You know, they've gotten vaccinated, they get careless, they start intermixing with each other, they forget about their masks, they forget about their social distancing, and we start to see those surges.
Right.
So we're hopeful that people will remember and that their frustrations that have happened by being pent up, by being locked in, won't be so great where they're just so free and then just start forgetting about their masking.
So let me ask you a question, doctor, on that. What can children safely do right now, according to you? Can they hang out together? What about when they're playing outside? Is it safer in the park? Or if the parents are vaccinated in both households, do you recommend they can all hang out inside? I would like for you to give our audience a little bit insight into what the children can do right now.
So this is where it's also very confusing because the CDC recommendations are for people who are totally vaccinated. So we know that kids are not going to be vaccinated, right? So when you have 2 adults that are vaccinated, they can be inside a household without their masks. If the child is of the same household, they can be without the mask, but once again, we don't know if the kid is outside, are they going to be a carrier, and are they going to go ahead and pass that pass that virus back on to the adults? And if the adult doesn't have full immunity against COVID, then will they manifest COVID or not? So all of these uncertainties that are there limit us on what we can say emphatically and, that kids can do this, 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 and this. So what we say is kids can go ahead and interact. Kids can go ahead and be with other kids as long as they're masked, as long as they're safely distanced, because being locked up also leads to a lot of mental health issues.
Right.
What we're seeing is depression, where the kids are not able to interact with peers of their own age. So we want them to mix up. We want them to learn from each other. We want them to be in that social interaction, which is absolutely critical for our kids. So they need to have that in place. If they're outdoors, the recommendation is they can be without their masks when they're in a sport. But once again, it is something that is taken on a case-to-case basis.
Right. And doctor, you just mentioned mental health, and that was my next question to you. Lives of children has been turned upside down because of this pandemic. They're not able to see anybody, they're not able to do much, and we're still trying to figure out what is safe for them or not. What kind of mental health impacts have you seen in children in your own practice? And, for parents that might be watching this show, what do you recommend that they work on to really improve the mental health of the child?
So there's definitely a few things that are coming up quite a bit. One is obesity. Kids are gaining a lot of weight because they're at home, they're not going out. Kids are feeling depressed. They're not able to interact with their own peers. We as Indian families, our South Asian families, we say, okay, it's great. We're as a family together, our kids are with us. This is great bonding time. Yes, it's great bonding time. But if your kid is in the adolescent range, if they're in that and they're not well connected to their parents emotionally, or, not able to hang out with them on a social ground, they do need that social outlet. They do need to interact with peers of their own age group so that they can talk about things. They can have fun with them. They can play games with them, which they may not be able to feel at comfort with the parents. And as parents, we need to understand that the kids do need that outlet. So trying to make sure that our kids are happy, trying to identify warning signs of their kids being sad, because that's the time to intervene and make sure that we intervene rapidly and not let them get into that hole where it's harder to pull them back out again. So I think that's one of the biggest things that we're seeing is depression, mental health issues that are coming up, obesity that's coming up, and all of these are really going to impact the kids very negatively, and they are already impacting them. And we hope that soon we can get them back to normalcy.
Just two more questions left here for you, Dr. Mehrotra. You are a pediatric specialist. So from that perspective, what's your biggest worry or fear when you are looking at children COVID-19 right now?
In terms of the disease, obviously we worry about the disease. How is it going to be impacting the child? Is it going to be that one kid who's maybe going to have something much more than just a fever or a sore throat or a loss of smell? Is that kid the kid that's going to end up being in the hospital, right? So we should not take COVID lightly just because we say, okay, 95%, 98% of the kids are going to do fine, but we still have to maintain that communication with our healthcare provider. We have to make sure that we take care of the symptoms, and we have to make sure that those kids don't deteriorate rapidly, because they can. So we need to be aware of that for COVID, the disease. Secondly, we need to make sure if the kid has any sort of underlying disorder, that we pay attention to that. So if they're diabetic, if they're asthmatic, if they have any other chronic illness, we need to make sure that we're in communication with the healthcare provider to tell them that, okay, this is what's happening with my child. Is it right? Is it wrong? What should I do? Making sure that the kids are still going for their well visits, making sure that they're getting their vaccinations on time. Over the last year and a half, people have gotten so scared. They're staying at home. They're not getting the routine care that they really need. So the kids are missing out on, their well visits or their vaccinations. They're falling behind. The biggest fear is that we're worrying about COVID right now, which rightfully yes, but are we forgetting about other illnesses that might have a surge because these kids are not getting vaccinated on time? So that's for COVID and just general. In terms of mental health, definitely identifying our kids, making sure that they're not getting withdrawn, looking for those warning signs, sleep disturbances. Is the kid just not happy? Is the kid not eating properly? Is the kid not talking to you? These are first signs of mental health issues. We need to intervene right then and there and understand, why is the kid not happy? Why is the kid not doing their normal activities? Then we have to worry about their obesity, right? We have to worry about, how is the kid active? What is the activity level? Are we so scared that we're not letting our kids be out and playing around in the backyard or going to the park or going hiking? We've really limited a lot of the physical activity that these kids need. And then they're sitting at home, right? They're on virtual classes, Zoom all day long. They're sitting there eating junk food. They're eating whatever food that they can get, because the parents are also busy with their work. So you have the parents being busy at work, the kid is sitting there, maybe they're eating whatever they want, they're gaining a lot of weight. All of these things are going to have long-term impacts, and they are as much a part of the corona pandemic that we can think of. So we need to be aware, we need to be proactive, and we need to make sure that the kids don't get neglected.
Yeah, that's so true. We can't have the children be neglected. They're a huge part of our society. My last question to you, actually, I would love for you to appeal to children right now that may be watching our show. Any advice to them, anything that they can keep up with? I think it'll be great for them to hear from you.
Sure. Some critical advice, okay? Make sure that, I know you're on Zoom all day long for your classes, but as soon as classes are done and your homework is done, get out of the house. Figure out some sort of physical activity that you can do. Try to go ahead and interact with your neighbor or whichever close friend you have, so you can have some normalcy in your life as much as you really can. And the other thing is, if you are feeling down, if you feel that something's not going right, reach out to somebody you can trust. If it's your parent, if it's your friend, if it's your sibling, if it's your doctor, anybody. Don't let it get you down. There is a light at the end of the tunnel, and I think we're getting there very soon. So yes, we've gone through a tough time over the last year, year and a half, but pretty soon we should be able to get back to our feet, and we should be able to be the way we were, hopefully very soon.
Hopefully very, very soon. I hope that too. Thank you so much for your time here on ITV Gold today.
Thank you so much, Aditi.